grandfather in the late 1920s, bear in mind this is the Great Depression, my grandfather started having sores and pustules and all kinds of crazy stuff going on with bizarre symptoms. So he went to the popular University of Michigan, which was a medical school back in the day, or a more popular medical school you'd say, back in the day. And they said, we don't know what's wrong with you. You need to go see this new doctor that works out of his house. He's a hot shot, named Dr. Mayo. So my grandfather figures, I need to figure out what's going on with me, gets on a train, goes to Dr. Mayo's house. This is the same Dr. Mayo way before Mayo Clinic. So he sees Dr. Mayo. Mayo makes a diagnosis of Hodgkin's lymphoma. Told my grandfather he had about 6 months to live and to go home and get his affairs in order. So my grandfather gets on a train, goes back to Michigan, and unfortunately this was the Great Depression, so he had to go back to work, obviously. Even though he had 6 months to live, work wasn't an option. So he goes back to work, and as luck would have it, there was what he termed a chiropractor 2 buildings down from the building he worked out of. So he thought, well, what do I have to lose? I got 6 months to live. I'll go see what this guy can do for me. So he goes to this chiropractor, gets adjusted. He gets about this much relief. But that little bit of relief gave him hope. And this chiropractor encouraged him to go to Davenport, Iowa. Davenport, Iowa is really where chiropractic began, with the founder being D.D. Palmer, the son B.J. Palmer, who ultimately ended up taking care of my grandfather. So B.J. Palmer adjusts my grandfather once in the neck with a rather forceful, back in the day it was a wham, they just really laid in. But my grandfather, within 3 days, was asymptomatic. So all the pustules were gone, fever was gone, he was feeling great, so he decides to enroll in chiropractic school. So he enrolls in chiropractic school, sends a telegram back to Michigan, says, hey, I'm going to be a chiropractor. The whole family disowned him at this point because they thought, you're wasting your time doing something so bizarre. But anyway, my grandfather goes through chiropractic school, goes back to Ann Arbor, Michigan, which was a very medical community, sets up his office, and starts taking care of people. He was also one of 7 doctors to actually have x-ray equipment. That's including medical doctors. X-ray was pretty new in the very early 30s, so not a lot of people utilized it. In fact, if back in the day, x-ray, you could go to a shoe store by 1936, 37 and hold your foot over a plate, and they basically exposed you the whole time to make sure your shoe would fit. But anyway, a sidebar. And if I get off track, you have to catch me on that and put me back. That's your job.
Thanks, Greg.
That's my lovely wife, so yeah. So anyway, my grandfather's 3 years into practice, and back then his x-ray equipment had a huge counterweight in the wall, so it was this big block of concrete with a cable that came up over it. The cable snapped, the equipment came down, hit him forcefully in the shoulder. All of his symptoms came back. So he'd only been feeling good and perfect for almost 3 years. And my grandfather went from chiropractor to chiropractor around the area, getting adjusted and trying to get fixed, basically put back together. Well, unfortunately, he got worse and worse and worse. So finally, my grandmother says, hey, we need to take you back to Davenport, Iowa to see the B.J. Palmer, the guy that adjusted and fixed you the first time. So they get on a train, they go back to Davenport, Iowa. B.J. Palmer takes care of him again. This time it took 3 adjustments, but once again, asymptomatic. So my grandfather decides that he needs to figure out what this guy's doing different than what everyone was learning in school. So my grandfather hung out for about 6, 7 months. There, he took in laundry at night. My grandmother taught at an elementary school to keep them afloat financially. And my grandfather studied what he was doing and what made him superior to some of the other chiropractors. And one thing he picked up on was that this chiropractor had like a 3-dimensional analysis. He could look at x-rays, set up on a patient, and he would set up like they were taught. You were taught to be high or out, whatever, but if you were 5 foot tall, 6 foot tall, there was no specificity to it. It was just a force going in some random direction. And if you've ever shot pool, what happens if you're off with your pool stick? You get the desired result. So my grandfather got it fixed in his head. He would start taking x-rays immediately after determining the patient needed adjusted, and then immediately after he adjusted the patient. So there was a lot of x-rays being taken in the 1930s, but out of this, over the course of 10 years, he developed a protocol. And this protocol was a more precise delivery of an adjustment that would guarantee quicker, faster, and more holding power, meaning you would hold your adjustment longer. This protocol that he sort of developed, he just kind of meant for it to be, something in his own office, but other doctors caught on to what he was doing. And so next thing you know, he's doing seminars. By 1946, he started with his first class of 30 chiropractors that learned what was later termed the Grostic technique or the Grostic protocol. This technique then evolved over the years. One thing that my grandfather did pick up on, which is really huge today, was the amount of force that went into the adjustment. Most people think chiropractic is kind of a wham or a twist or a pop or whatever. My grandfather found out that all you needed was a very little bit amount of pressure as long as you lined the patient up just right. So, and it was based on pre and post x-ray. So he could show you that you had a misalignment in your neck, something going on that wasn't right. He would adjust you and then show you that he indeed fixed it or changed something positively. This protocol evolved into 3 or 4 other protocols after my grandfather's death in 1964, one of them being orthospinology. There's a few orthospinology docs here in the area, one in Blue Ridge, or one in Blue Ridge being me, one in Blairsville, and one up in Murphy, and then I think there's a new guy opening up in Ball Ground. But that is the orthospinology protocol. Then it branched off into 2 other protocols, NUCA and Atlas Orthogonal. They're all relatively the same protocol with the precise adjustment. It's just the way they deliver the adjustment, whether it's an itty bitty little, looks like a gun kind of, but it just has that little bit of force, very little force. So it's not very intimidating. One of them uses a vibration force, and then there's of course still a hand adjustment, but instead of a big elbow bend and a wham like that, it's just a little itty bitty like that, and you get a great correction. But anyway, that's a little bit of my history with my grandfather. Then along comes my dad after my grandfather passed away. My dad was, for lack of better terms, a really, really smart guy. Had a nice pocket protector, pens, glasses, tape, the whole 9 yards. My dad was just a really, really super smart, inquisitive man. And so he took over the research department at Palmer College in Davenport, Iowa. While he was there, he did some pretty cool research there where they did the Myers-Briggs test. Anyone not heard of Myers-Briggs? It's a personality test. So you would administer this test before you adjust the patient, and it would tell you what kind of personality they had. Then you would adjust them and immediately administer the test again to see if their personality changed. It was kind of cool that every personality changed. So you can take someone who is one way and adjust them and create a better person almost. The other research he did was out in Colorado, where they actually did you're all eating, but dissections. I'll leave it there. And then he got recruited by Life University here in Marietta, Georgia, to take over the research department there. So he took over that research department. The president at the time was Sid Williams. I don't know. Anyway, Sid Williams was the president. Gave my dad basically a blank check to do whatever kind of research he wanted. So one of his big first research projects was taking on AIDS. So what he did with AIDS patients was he had, there's HIV positive, then there's AIDS. AIDS is the bad. That's when you're actually physically manifesting the disease process. So my dad took this group and then he got in cahoots with, or working with, Emory University and the World Health Organization. And what they did was they took these AIDS patients, put them into 4 different groups. One group got the popular drug AZT. AZT is an awesome drug. It actually takes your white blood cell count and brings it up very high so that you can outlive the disease or at least make it manageable. One group got sugar pills. One group got adjusted with an instrument like what I use with the Grostic protocol, and one group got adjusted with, well, they didn't get adjusted, it was an instrument, they couldn't even touch the skin, it didn't click, they held it over the patient's head and said, okay, you're good. So out of those 4 groups, the study proved a couple things. One, AZT worked as advertised. It brought the white blood cell count up to here. But the coolest thing was chiropractic care over time, course of 2 or 3 weeks, took the white blood cell count and kept it going in a more positive direction. And the coolest thing about this was, everybody familiar with Magic Johnson, popular basketball player? Well, he had full-blown AIDS. He heard about what was going on at Life University. He said, hey, get me a plane, I'm going out and meet this Dr. Grostic, my dad that is. So he comes into the study and he's like spending $4,000 a day on AZT, $4,000 a day. But his white blood cell count only came to here. So while he was under care, his white blood cell count continued to go up. So that's how powerful chiropractic is. I mean, a lot of people under the misconception that it's, oh, I got an ache, or I got a pain, or I got a little sciatic, or I got something going on. But it's much, much bigger than just an ache and a pain. Does that kind of make sense now? A little bit? And the other cool guy I got to meet was, he used to live in Atlanta. I don't think he's there much anymore, but Elton John funded the second part of the study. So it was a really interesting time for me because I was in the military at the time and got to meet some cool folks. My dad's third and probably most popular research was using cadavers, where he looked at the spinal cord and what actually causes, because you usually think a chiropractor they use the garden hose analogy. Garden hose is a pinch, the pinch in the garden hose, the nerve is dead, it doesn't work the way it's supposed to. He went into some greater detail to prove that there's a lot more to it than that. I could bore you with some really crazy anatomy, but I won't. Anyway, how I came into chiropractic. So that's my grandfather, that's my dad. I came into chiropractic because, well, I was a bad egg out of high school, and before my parents got my grades, I enlisted in the Navy because I knew they were going to kill me. They were spending some money, and I was having fun with it. So I joined the Navy, and I was young, and decided that, full of testosterone, 18, I wanted to play with rockets and bombs and missiles. So that's what I actually did, was I loaded rockets, bombs, and missiles on airplanes. Well, as fate would have it, one day I'm loading a bomb on an airplane. The guy across from me, we used to load them by hand, get underneath them, and lock them into these airplanes, into some hooks. The guy across from me, let's go. So I take the full weight of the bomb, I'm like this, and I felt something on my back pop. So, well, the cool thing is, in the military, physical therapy is free. So I went the physical therapy route. 3 months later, after getting off of the crutches, I had electrical current shot through me, a couple shots, stretched. I mean, I had everything done to me you can think of. And I was walking pretty decent into 3 months. And they said, oh, you're healed, go home, enjoy your life. So my son was about the size of a football then. And I'm like, well, I'm good. So I'm putting him in bed. I lean over like this. And you ever had that problem where you lean over like this and you get a little catch? Well, mine locked up totally. I went forward, got my son out of the way, and I said, you know what, this is bad. I should call my dad, which I kept this I hadn't told him anything. So I call my dad. At this point, he's head of research at Life University. He grabs a plane ticket, flies out, and says he's going to adjust my neck. And I remember looking at him going, Dad, you are on drugs. What is wrong with you? You just flew all the way out here to play with my neck when I blew my back out. So my dad, he was a very, like I said, the pocket protector, very passive man, just kindly calms me down, says, well, I need to adjust your neck, and then we'll see. So he sets me up, he adjusts my neck with this low, low force, and I'm laying there, I'm angry. I mean, I really am, I'm angry, I'm like frustrated. And he leaves the room and says, rest for a couple minutes. So while I'm laying there, all of a sudden I feel this release in my low back where it had been so tight and so locked up, this nice release. And it was like amazing. And it was that one adjustment that caused me to think career change, as well as my low back was fixed with one adjustment. So, and I didn't need any repeat adjustments after that because, well, he checked my legs. He sent me a local chiropractor, checked my legs and checked my posture, and I was feeling great. So anyway, that's when I got the idea of becoming a chiropractor. So I enrolled at Life University and graduated in 2000 and set up my first practice in Kennesaw, Georgia. I don't know if many of you travel to Kennesaw, but it's not a bad place to live, but Blue Ridge is so much nicer. The people here are friendlier. Everyone's nicer. And plus, I grew up in a small town in Iowa. I can't deal with big city life. It's just not me. So anyway, that's mine. Now I've taken up all my time, haven't I? No. How much time I got?
It's only like
Good,
37-ish.
good. All right, so what I'm going to share with you is one, a model of health, and show you how broken our healthcare system is here in the United States. Two, I just kind of, well, basically just open your mind to what healthcare is and what really healthcare should be. Two, I'm going to explain a little bit about generically what chiropractic is. And then three, I'm going to explain more specifically what I do that makes me different than most other chiropractors that you'll ever run across. So I'm going to give you some quality information so that you can make quality decisions about not only your health, but the health of your loved ones and the health of people you know. Now, when I talk about the healthcare system, we actually are the best in the world and with healthcare. We have the best emergency care. We have the best hospitals. We have the best trained doctors. We have the best trained nurses. I mean, there's people come from other countries to come here to learn healthcare, to learn how to be the best. The funny part is we spent $2.9 trillion last year on healthcare. That's a key thing to think about, $2.9 trillion. And what are we getting for this $2.9 trillion? Emergency care, trauma care, crisis care. We have the best. If you have we have the best burn outfit, burn victim places. We have the best. We have robotics and surgical, that other countries can't afford or don't have. We have just amazing quality healthcare from that regard. And this is crisis, emergency. But what about the other, that's 99% of our health is not emergency care. 1% of our health care is where that $2.9 trillion goes. That 1% is that emergency care. Does that make sense? All right, so what are we getting, or how are we managing the rest of our health care? And this is one of the scary statistics. According to the World Health Organization, the U.S. ranks 79th out of 81 industrialized nations according to the Total Health Index. Now you can Google it and it'll say 19 right now. But when you take into account the financial burden that's placed on the average United States citizen, it actually takes us down to 79th because there are people in this country that can't afford or can't get the care that they need in the emergency world. And the reason that we also fail in this is think of like heart disease. Heart disease back in the 1950s and 1960s, that was people who ate bacon for breakfast, lunch, and dinner, washed it down with 3 or 4 cups of coffee, kicked back 3 packs of cigarettes, and they were overweight. Now we have heart disease, not only in that group, but now we see it in children in our schools. We see it in middle-aged people, more than we ever have. Cancer's definitely up. There are more and more cancer centers opening up all over our country to try to take care of cancer patients. You go back 50, 60, 70 years, cancer was around, but it wasn't as prevalent. Diabetes has gone up 600% in the last 5 years. 600%. You can go over to the middle school, the elementary, the high school, and you will see kids now that are diabetic. And we're not talking born with it, we're talking type 2. And we're seeing more middle-aged people with diabetes than we've ever seen. Infectious diseases going up. Why? Mostly antibiotic abuse. Not that antibiotics are a bad thing. Antibiotics are great, but used back in the 60s and 70s, you would go to your doctor and say, "Oh, I've got a sniffle." They didn't even bother seeing what the cause was. Boom, they handed out like Tic Tacs. Here, take some of this. Autoimmune conditions where the body's attacking itself. The United States has a rapid incline or increase in autoimmune conditions where the body is just altered, whether it's lupus, whether it's, there's a host of autoimmune disorders. Iatrogenic is really big. Iatrogenic means you go to the hospital, you're going in for surgery for one surgery, but because of that one surgery, now you need one more surgery. Or even worse, you're put on a medication, And another medication could be even multiple doctors involved, which is where some of the problem gets, but you end up taking drugs that cause other problems. I mean, I see patients who are on metformin and lisinopril and another drug, and when you combine these three drugs, they end up with severe muscle pain. I mean, it's a side effect. Is their cholesterol down? Yeah. Is their blood sugar down? Yeah, but now they have immense body pain, and it moves around the body, and it's now they call it, in some cases they call it fibromyalgia. Fibromyalgia means nothing more than we don't know what causes it, you got pain somewhere in your body. And what has gone wrong? Why are U.S. healthcare costs rising faster than any other country as our overall health declines? So as a country, we're not faring too well. There are countries that are doing a much better job than we are here in the United States. The problem isn't our model of healthcare. In other words, our basic beliefs about what health is and what we need to do to achieve it. Under our present model, health is defined by how a person feels. And what's the major problem with this? If we're basing our health on how we feel. This is a dentist, in a dentist's office. You get a toothache, right? The toothache, you felt it for 2 hours. You go to the dentist, they say, oh look, you've got a cavity. Well, that cavity wasn't just there for 2 hours, it's been there. So the trick is addressing a problem before symptoms present. Make sense? One of the most common first signs of coronary heart disease is death by fatal heart attack. So basing symptoms on, if your symptom is fatal heart attack, I don't think I'd want to wait until the last minute to figure out that, hey, I might have that going on. So don't base your health on the presence or absence of symptoms or how you feel. There aren't any scientific or medical textbooks that define health based on how we feel. Whether it's Dorland's, whether it's Webster's, any one of the medical books, none of them are based on how you feel. So you see where we've kind of gone? I mean, just think about commercials you've seen recently on TV, flipping through a magazine. Everything is about how you feel. Symptoms and healing. Coughing, sneezing, fever, vomiting, pain, diarrhea. Are these symptoms of healing or are these symptoms of sickness? They go both ways. But guess what? If you're coughing, what are you trying to do? You're trying to get something out of your body, right? So if you're coughing, you go to the local drugstore and you buy something that stops your cough. But that's not getting it out of your body, so now you have toxins developing in your body. Sneezing, same thing. Pop a bunch of antihistamines, guess what? You're no longer sneezing, but that sneezing process was helping get things out of your body. Fever is a good thing. I mean, having a little fever is not a bad thing, but people get a little bit of fever, boom, take some aspirin, take some ibuprofen, get that fever down. Vomiting is normal. I mean, if you go out and you ate bad chicken, last thing you want to do is keep the bad chicken in you, right? So you want to get it out. Pain to some degree. You twist your ankle really bad. That pain is there for a reason, to keep you from walking around on it. So taking something so that you can walk around on it's only doing the body more harm. Make sense? Diarrhea. Well, that's kind of like the reverse of vomiting, just the other end. The U.S. is the most medicated country in the world. We consume 68% of all the drugs in the world. Half of all Americans take at least one prescription drug on a daily basis. And that's actually probably a year ago that I got that information. But more recently, it's close to 3/4 of the population now is on one prescription drug at a minimum. Whether it's a mood, whether it's blood pressure, whether it's blood sugar, everything is about trying to make people feel better. In constant dollars, Americans spend more than $300 billion on prescription drugs last year, up from $104.6 billion in 1999. That's a pretty significant increase in spending. So we are spending a dinkload of money on drugs. The pharmaceutical industry is the most profitable industry in the world and therefore directly influences and affects U.S. and global healthcare policy. Of course, you got a politician here, so it makes it fun, but all right, let's go. If you ever come across an old magazine from like the 50s or the 60s, you will see that the tobacco industry had a huge influence over what was printed. So back in the day, the tobacco industry sort of bought out the medical community in such a way that if you had bronchitis, guess what the treatment was? Go get yourself a pack of cigarettes. And it was 1 out of 5 or 4 out of 5 doctors recommend Pall Mall or Marlboro. So, I mean, that was a protocol back then. And if you had it really bad, you got the ones that had the menthol in them. So anyway, I'm kind of trying to stress the importance of how much money influences what we see, what we hear, and how our brain starts to perceive what's going on around us. 80% of the average pharmaceutical industry's budget is used for marketing. 80%. They're making a lot of money. I mean, think about how many bottles of aspirin, how many bottles of things of antihistamines, how many of those are being consumed on a daily basis? Not to mention just the prescription, those are over the counter. Now the prescription drugs, some of those are off the market, overpriced. I mean, the price you pay for them and what it costs to make them, oh my gosh. So anyway, basically they're competing with the Fortune 500, and they are probably, at the top of the line there. So basically, does big business influence healthcare policy? And that was what I was trying to drive with this, is just kind of get you to wrap your brain around a little bit of what's going on in the world. And not that drugs are not a bad thing. I never would say they're a bad thing. I'm just stating that the medical profession and the AMA and those folks, especially the drug companies, have an invested interest in you, the consumer, consuming their product. And their product is drugs. So they want you to take their drugs, and they're going to sell you on health, but not health the way it should be, but health from the perspective of, we want to treat your symptom. There's even, it was a joke, I think it was a joke, I saw it on Facebook. There's a drug for people that are too happy. So, I mean, they will create a drug for whatever ails you. But now I want to kind of talk about from the chiropractic standpoint. So from the chiropractic standpoint, we have health. The word health has heal in it. Our bodies are healing consistently. I mean, from the day we're conceived to the day we die, our bodies are always replacing cells. They're always working in harmony to try to keep the body alive. And in this particular formula, health equals optional function times innate intelligence. Now, anyone heard of innate intelligence? Probably not. Innate intelligence is a kind of a chiropractic term, medical term, but mostly chiropractic. Innate intelligence is that intelligence in the body that keeps you alive. Whether you're sleeping, even if you're just sitting here and you're sitting upright, you're not thinking, hey, sit upright. You're not even thinking, breathe. How many of you are saying, I have to breathe right now? Breathe. No, your body's breathing. So innate intelligence is that intelligence in your body that you don't think about. That intelligence is what keeps you alive, keeps your blood pumping, keeps your heart moving, keeps your body temperature in a certain range. So that is what innate intelligence does. It is constant. It works 24/7 to keep you alive. Optimal function, that's variable. That means if something is wrong, like you cut your finger, you have a cold, whatever it may be, that can take away from your total health. Best way is, this is a picture of, everybody not know who that is? Billy Joel. Billy Joel, his signature piece, The Piano Man. Everybody familiar with The Piano Man, or am I just that old? All right, Piano Man was his song, right? And he could play it perfectly. No matter what, he plays it perfectly. Now what happens if the stage crew's setting up that stage and they don't tune his piano? So his piano now is the problem. He goes out and plays his signature piece and it doesn't sound like it's supposed to. So the variable in this formula, the piano not being tuned, the musician playing his best work ever, decreased health. Make sense? I kind of wrapped that around in such a weird way. Anyway. We're going to go really, really fast right now. All body systems will be immobilized without the nervous system. It controls and regulates every body activity down to the workings of the tiniest cell. Boom. Your spinal cord and your brain, that's the controlling organ, the controlling part of your body. So what happens if you sever your spinal cord? What happens if you take out the brain? Your body ceases to work. This is very important for regulating and maintaining your health. To understand health is to understand the central role of the brain and the nervous system in maintaining the resistance of the body. Health maintenance is the primary function of the brain, not educational thoughts, language, poetry, other functions usually associated with the brain. So like I said, I'm trying to drive it home. The brain's main purpose is to keep you alive. The quality of healing is directly proportional to the functional capability of the central nervous system to send and receive nerve messages. The central nervous system is protected by the hardest bones in the body, the skull and the spinal vertebra. The skull being here, really hard, firm, non-movable. The spine is movable. It is able to twist, turn, and that mobility allows for the potential for rearranging those bones. When you rearrange those bones, you can actually change the way the nerve impulses move through the body and get to the end, wherever it is coming from or to. A little picture, there's your spine. First 7 cervical, 12 thoracic, 5 lumbar, and your sacrum right down there. That's what houses and protects your spinal cord. A vertebral subluxation. Vertebral subluxation is the term that exclusively belongs to chiropractic. Vertebral subluxation is a misalignment of one of these bones, creating nervous system interference. Now, can you have a misaligned bone without nervous system interference? Totally yes. But when you have a misaligned bone that's creating nervous system interference, that's what we as chiropractors address. In this particular misalignment here, this is based on the Grostic protocol. What we're really looking for on x-ray or whether physical is head tilt, high shoulder, something indicates an imbalance in your body. And then our job, or my job, is to restore, center, bring that in. And the funny thing too is if this has been off for any length of time, off like that for any length of time, eventually the hips will adapt. So getting that corrected is huge. It helps with spinal cord, reduced spinal cord tension, helps with venous drainage, blood coming from the brain, arterial supply, oxygen supply to the brain, cerebral spinal fluid movement. That's the latest research we have going on right now. Balance, stress, decreased pain, and fix altered function, like even people who walk funny. You know, just because they've had their hip like this so long, they have a limp, or they have their foot turning in, or they have a long host of things. When the central nervous system cannot communicate at an optimal level with the rest of the body, because of vertebral subluxation, the overall function and healing potential are reduced. Subluxations are not necessarily evidenced by pain or symptoms. So you could be subluxated, have a little misalignment, and maybe you let it ride for a week or two. The next thing you know, you've got these headaches, or you've got a hearing problem, or even worse, intestinal issues. I've taken care of patients where Crohn's disease or severe intestinal issues that have a result of postural distortions, or the body not being in its normal position. Subluxation is very real. We've documented to the extent that no one can dispute its existence. Vertebral subluxations change the entire health of the body by causing structural dysfunction of the spine and nerve interference. The weight of a dime on a spinal nerve will reduce nerve transmission by as much as 60%. The coolest part of this little study, it was done out in Colorado. My dad was the one that put the dime on. Causes of subluxation. Subluxations are caused by physical, chemical, or emotional. You can be stressed out and your muscles tighten up and you can cause a subluxation. Childbirth, very delicate spine. Baby's delivered, a little twist, a little turn, a tug. Whether it's a football injury, we got kids going back to school right now. Backpacks, heavy backpacks on these little kids, and they're leaning like this. Guess what? They do that every day. It's repetitive stress. to the body. Car accidents, the list goes on and on. We're going to fly through a few of these, and I'm running out of time here.
And if anyone needs to leave, we're not offended if you guys have.
I will be offended. I will take names and I will get addresses.
Other than him, but otherwise don't feel bad if you do have to leave, but yeah.
All right, everybody remember Christopher Reeves. He played Superman. Pretty good looking guy and had a promising career. Was an avid horse rider, was out riding horses, went over a steeple, fell off, broke his neck. Severed it, but not completely. So he still had some function in his body, but he was confined to a wheelchair for the rest of his life. He ultimately died. So would it not stand to reason that smaller repetitive forces could have a bad effect on your health? So whether it's the childbirth, the backpack, or now we've got a new epidemic, text neck. Text neck is very, very real. I've got all my grandfather's x-rays from the 1930s, 1940s, and I can go back and look at some x-rays of kids who have perfectly normal cervical curves. I'm getting kids now that come in with migraines where I've looked at their x-rays and their head posture is literally like this. It's falling forward. And so we're seeing changes over time. And the only way to correct it is one, well, naturally, pull the phone out, get the TVs up, whatever up, and then get them chiropractically adjusted to kind of help pull it back and maintain normal. Posture affects and moderates every physiological function from breathing to hormonal production. I've seen where some misalignments or postural changes can even lead to things like endometriosis, which is a female condition. Deviations in the body's center of gravity, sometimes it's this way, sometimes it's this way. It doesn't matter how it is, but if your body's off center, it's not going to function the way it's supposed to. And honestly, all you have to do is go to Walmart, Ingles, anywhere, and just observe people. The people who you see who are humped over, are they healthy? No. I've got patients who are in their 90s that are perfectly healthy, who stand upright, they're physically active, they still play, what's that, pickleball. I don't know what that's about, but it's popular. Despite the considerable evidence that posture affects physiology and function, the significant influence of posture on health is not addressed by most physicians. So that's kind of a chiropractic niche. The purpose of chiropractic, to detect and correct vertebral subluxations by physically adjusting the spine. Now this is not a Grostic, unfortunately, well fortunately, I grew up in the chiropractic profession, so I've learned virtually every protocol taught in the chiropractic schools. So this is a standard chiropractic procedure here that I'm doing, but physically adjusting the spine there. The purpose of the Grostic-based care is to reduce misalignments and restore alignment, allowing for body balance. And all I take is that little itty-bitty amount of force. I do not do any twisting, popping of the neck, because Lord knows, you log on to YouTube right now, you can pull up some pretty scary videos of chiropractors, and they're not even chiropractors in some cases, but wrapping towels around people and tugging them, or hanging weights from their neck, and it's not necessary, in my opinion. Don't want to offend any of the other docs. And chiropractic really is for all ages. I take infants. Infants have a spine. Guess what? You want your infant to grow up to be normal and healthy? You get that infant checked. The coolest thing is not all infants need adjusted. I would say 1 in 10 that I look at actually have a problem that needs adjusted. But 9 out of 10 just have that reassurance that there's nothing wrong with their little one. Kids take falls, they take spills. This patient in the very middle there on the right, 92 years old, physically active, still cuts his grass. And on the right there, I've got one of the teachers here in town. She's pregnant. Makes pregnancy so much easier. I mean, the hip pain, the back pain, everything. It's so much easier when you're in adjustment. This is my grandfather from 1946, guy I was talking about earlier, who was diagnosed with Hodgkin's lymphoma, who lived to be into his late 50s, which considering he was supposed to be dead in his 20s, that's pretty good. This is the other protocol that comes from my grandfather's model, the orthospinology procedure. And right here, you can see that's postural distortion. high shoulder, head tilt, low back pain, mid back pain. And after our care, that's what you should look like. That doesn't sometimes happen overnight, but sometimes it does. This is an even better representation of the Grostic model with the head tilt and then restoring the head and neck to normal. When I was talking about the recent research, as long as I got you all here, I can torture you for a few more minutes. The newest research I've got going on right now uses the state-of-the-art MRI unit. There's only 2 of them in operation in the United States. The other one is in Egypt. The guy that actually invented MRI 30 years ago, hard to believe MRI's only been around for 30 years. All right, so the newest MRI units, one is in New York, one is in Boca Raton, Florida. The one in Boca Raton, not as, I guess it breaks down a lot, put it that way. But the one in New York, I have MS patients in a study, close to 481 MS cases. The coolest thing is if you look through the medical literature, there's no known cause of MS. They say it's either bacterial or viral. But what we're finding is the brain actually drops down the width of a fingernail. That width of a fingernail changes the dynamics, the way the cerebrospinal fluid, which floats around and kind of bathes your brain, moves around your skull. And what it does is it changes the nerve impulses so that you end up having feeling and problems in your fingers and your toes, and it spreads back up. That's classical MS. So if you can restore the neck to normal, you can actually reduce, if not stop, MS in its tracks. Then the other beauty is there are a couple cool drugs on the market that help reverse the process as much as possible. Ketogenic diet, I go down a long list, but that's not for me. This is my dad. See, he's just missing the pocket protector and his glasses. We took them off for the picture. Your choice is to take part in the chiropractic lifestyle, which is a step in the right direction towards a healthier you, a healthier family. And if you're not under chiropractic care, I encourage you to find a chiropractor. If you haven't found a chiropractor yet and you need one, hey, right here. A little bit more about what makes me different is I'm certain I'm the only one that does no twisting, pulling, or popping of your neck. I do not do that. I don't like it. There's no reason to do it, in my opinion. I have state-of-the-art x-ray equipment, nicest x-ray equipment north of Emory University. What that means to you is 40 to 60% less exposure. To me, it means a much higher megapixel, which means I have a big monitor I look at your x-rays on, and it's just like spot-on perfect imaging. I also offer flexion distraction, not Grostic related, but it's another protocol for people who walk in like this and like this who have a disc problem. The coolest thing is if I have an MRI and an x-ray, I can take the 2 of them and kind of determine exactly how to place this table to get a correction in the low back to restore that to normal as well. And then I also offer hydro massage, and I have a massage therapist on staff. And that is it.